Could you tell me a little bit about your diagnosis story?
Oh, yeah, for sure. So I was diagnosed in April of 2014. I was 26 years old and I was working as a registered nurse at the time in the PICU. And so my husband now, but boyfriend at the time,
Mhm.
had actually come back from traveling with friends and he was quite sick with pneumonia. So I ended up getting this
Mhm.
pneumonia as well. And I was trying to be a typical nurse and work through it. And I was
Mhm.
at the hospital actually, and one of our intensivists was like, you can't breathe. Like I could barely get a word out. And at the time I was like, felt that bad sensation, but I just thought it was restricted breathing from the
Yeah.
pneumonia. I didn't really know I was weak. I was tingly. I
Mhm.
just thought it was all from that. Walked me down to emerge. I was admitted immediately
Mhm.
for all of that, had a full long workup of everything to make sure that I was healthy beyond just this virus, but they were confused why like a healthy 26-year-old female was getting taken down so hard by just a respiratory virus. So they were about to discharge me 2 weeks into my stay when the physiotherapist who was working on the unit was like, hello, everybody. This girl actually can't walk. Like, has no one noticed this before? I had completely lost my ability to like weight bear and walk. I was using a four-wheeled walker. I could barely even grasp like a 1 pound dumbbell. If I tried to do a bicep curl, my arm in proprioception was all over the place and I couldn't maintain like a singular movement. But of course, doctors, they just see you laying in your hospital bed all the time. And they were focused just on my respiratory system, like
Yes.
just one area of my body. And so I will forever be grateful to that physiotherapist and
Mhm.
that whole profession of just bringing like eyes into what your
Mhm.
patient actually looks like. Cause I was rushed down for emergency MRI that night.
Mhm.
And I was actually diagnosed that night with
Mhm.
MS. So like super different from a lot of people in
Yeah.
terms of I didn't have like lingering symptoms for
Mhm.
years. I wasn't in and out of doctor's offices
Yeah.
without answers. It was like crash, bang, boom. You have MS.
Mhm.
This is what's going on. So yeah, it was different that way. And then I stayed in the hospital for about 2 more weeks, just
Mhm.
getting my strength back and
Mhm.
recovering, and then was discharged from there. And then just kind of started that rehab journey back
Yeah.
to work. And so, but yeah, interesting. Definitely
That
different
is
when I hear other
that is
people like,
interesting. That's for sure. So it's like, was getting pneumonia a good thing? Because it taught like it was showing you other things that were like wrong in your body that you just didn't notice?
I
Or did it
think
take your immune system getting so compromised for it to fully come out? Like maybe there was little things you just didn't notice. Do you think that was the case maybe?
I totally think there was little things I didn't notice.
Yeah.
I chalked up everything to being a shift worker
Yes.
and to like not even worrying about it. So I
Mhm.
remember in 2012, I was actually running a relay race up in Skagway, Alaska,
Mhm.
and I had trained hard for it. Like I was an avid runner. I
Mhm.
was totally prepared for this race and I was doing the
Mhm.
21 kilometer leg, and about like 17K in, my legs gave out on me completely.
Mhm.
Like just I collapsed on the road and I tried to get up and they were shaking, and I again chalked it up to just being like, I guess I didn't train hard enough, or I didn't prep the right way or anything like that. So that's like one moment I look back on that I'm like, okay, that was a telltale sign. The fatigue would have been another one, but again, I was like a shift worker working nights. I just thought everybody was this
Mhm.
exhausted after working, but then I would like hear what others were doing on their days off or what they were able to do even after a shift. I was like, huh, I'm like really lazy. Like that's what I just
Yeah.
always thought. I was like, wow, like I'm lazy. Like I can't get up and
Mhm.
get going that same way. And then I would say too, maybe getting in and out of hot tubs and warm surfaces. I
Mhm.
was always like a little tingly and
Oh,
fatigued
okay.
and felt it in my face. But
Mhm.
I actually just thought everybody felt that way.
Right.
Like I grew up in a household where you didn't really question your feelings or talk
Okay.
about those things. Like it was swept under the rug.
Yeah.
Yeah. So I think there was some things, but probably only back in like, so I was 26, probably only like 3 or 4 years before what I
Yeah.
was, I
Yeah.
truly can say I noticed some
Mhm.
stuff. But at the same time, yes, I do think getting a pneumonia was a blessing because I didn't have to do the battle that
Right.
everybody else, like I think back thinking I would have thought that my recovery would have all just been post pneumonia fatigue
Mhm.
and weakness. And I would have been rehabbing the wrong
Yeah.
way and like not doing the things that my body actually would
Right.
have truly needed.
Mhm.
So, and then I think I would have gone down that battle journey that a lot of people do of like just not knowing what's wrong with them. And going
Right.
back and forth.
And how has your health been overall in the time since you've been diagnosed? I know it's been we're almost looking at 10 years. And I know that's asking like a question that like spans a large portion.
Mm-hmm.
Um, but could you just kind of recap that a little bit, if you don't mind?
Yeah, for sure. The best way to describe my health over the last 10 years is like the most intense up and down roller coaster you can possibly imagine. Like I have gone from places of losing my speech and not being able to communicate for a week to being able to wakeboard last summer still, to then going and not being able to work anymore because my fatigue has gotten so bad and whatnot. And then also I've gone from like using a four-wheeled walker and barely being able to even like dress myself or bathe myself to being independent and, you know, doing little small home rentals. So it really has been like a roller coaster, I would say. But overall, it's like until I found Ocrevus, it was almost a downward roller
Okay.
coaster, I would say. So the first couple of years, it was like just your typical confusion. Is this MS? I have no idea what's happening to my body. I'm tingly. I'm tired.
Yeah.
Sometimes my legs get shaky, but then my balance comes back.
Yeah.
And then the fatigue really started to hit home, and I had to decrease my work hours and go to straight days. So that's when I really started to feel like it was kind of like compromising my life. And then I started to notice kind of like every 3 months, it was like another little month flare up, but then it was always these pseudo flare ups because, of course, it was symptoms I've had before. Nothing was worse than before. So I wasn't getting treatment, but then at the same time, I always felt like just like really lost and always questioning, like, what is this MS or like, what is this? And then 2020 hit and my MS was really bad. Like my fatigue was bad. My depression was bad. I was using a four-wheeled walker. I lost use of my whole left side. So my left arm was useless and pins and needles. I lost like left core, left leg was completely gone. And it was starting to move into my face too, where I kind of had like a face droop. But because COVID hit, we decided to like postpone on the a true immunosuppressive.
Yeah.
So I started on Copaxone instead. And like, honestly, within a month, I was like, this is not doing anything for me. Like, I know it's not, but because of the insurance battles and what you need to do to prove true progression and qualify for certain medications, I had to stay on Copaxone for a year. And I was just like in a bad place. Like I just was always using my walker.
Yeah.
I'd maybe have a good day, but it was usually bad. Then I started Ocrevus in 2022. So I've now had 2 rounds of it. And that's what has finally brought like stability to me. Like I was going from like every day being like pulling out my walker, then having a good day, then pulling out my walker, then having a good day. And now I can like probably say it's been like months since I've seen my walker come out, but I use my cane when I'm tired and things like that. And winter's always harder.
Yeah.
But that's a big question. Does that answer it a little bit?
Yeah, it does.
Okay.
Were you on any medications prior to Copaxone? Or was that your first one?
No,
Okay.
that was my first one.
Yeah.
You know, there's always this like weird question, like I said, of like, is this MS? Is this not
Right.
MS? Because I would call all the time and they'd be like, you're not presenting as normal. I'm like, well, I also can't walk and I'm shaking uncontrollably. So like, this isn't normal, but is this not MS? So I was sent to Calgary for different opinions. I really went like the natural holistic route just because there wasn't this like confirmation between a group of neurologists. Like my neurologist and I have been firm on like my diagnosis from day one, but every other neurologist I have encountered, which has probably been about half a dozen of them now, every single one of them has questioned my diagnosis of MS. So that's why I really held off until we were showing like a true classical relapse, right? I think I have like an interesting point of view on that, like from being a nurse, because I very much believe in Western medicine. I support it. I think we need it. I'm on an immunosuppressant, but I've also seen all of the side effects, all of the detriments, all of like you're saying, like the bad stuff that comes along with it. And it's just like, you have to really outweigh your pros and cons. And for me, the side effects were always more intense than what my quality of life was being affected by with my day-to-day MS. So I would always kind of go back and forth looking. And I've lived with depression and anxiety since I was 18. And that's like the number one side effect on every single one of these medications. And I'm like, okay, well, I'm like already really dark sometimes. I don't really need like another thing making me clinically even
Right.
darker.
Exactly.
And even the immunosuppressant part, I thought I would just be getting colds and pneumonias and being worried about that all the time. I have to say, I truly haven't gotten like sick day to day more, which has been good. But the thing that keeps getting brought up to me is like the cancer risk. They're like, oh, like we're going to have to, like, we can only do so many rounds of this and then take a break because we can't allow you to be immunosuppressed because your risk of cancer will
Yeah.
be so much higher. And like, that was something I never really thought about before, was like the long-term game of these
Yeah.
medications.
I know what you mean. It's like, this is going to help me, but what else is it going to cause? Like after
Exactly.
Limtrada, I had basically thyroid disease. It has corrected itself now. And the endocrinologist that I saw, she had dealt with other people that had the same thing and it corrected itself. So she's like, I think it was just the Limtrada that caused this. And now, like, as far as we know, I'm still going to follow up with her with blood work and stuff, but now it's gone.
Right.
But I didn't think of that. There was
No.
other higher risk things that I didn't focus on this.
Right.
Like, yeah.
And the thyroid is such a huge
Yeah.
other game player in the hormones
Yeah.
that mess with our fatigue and stuff. And I've heard that about Limtrada,
Yeah.
about the thyroid disease that comes
Yeah.
along with it. And you're like, great, I don't need more autoimmune stuff. Thank you very much.
Right.
Your
Right.
plate feels full.
Yeah, because thyroid disease can lead to Graves' disease. So like I don't need to collect, I'm not collecting chronic illnesses. Thank you. So